We have interpretation this morning to English, French, Spanish, and Arabic. You can find the interpretation panel at the bottom of your screen, where you also see your microphone and video options. For Arabic, due to technical reasons of Zoom, please use the button Chinese. For not everybody has the updated version of Zoom, which allows the button Arabic. So please feel free to use the button Chinese for the Arabic language, which is below that language. And if you have any questions, please ask one of our colleagues in the chat. They will be able to help you. They should be identified with the tag PLATFORMA, so you can identify them in the chat. They will help you with technical questions or other questions that you might have. And as we are at 10 o'clock, I would like to welcome all those who have joined us in the morning and give the floor to the Secretary General of the Council of European Municipalities and Regions, Mr. Frédéric Vallier, to give us a short introductory opening.
Thank you, Boris. Thank you, all the participants, dear mayors, dear parliamentarians, dear colleagues. It's a pleasure to have you with us this morning for this EU Neighbourhood South Safeguarding Human Rights in the Post-COVID-19 Context seminar. This is, I believe, the first time we cooperate technically and politically with the Assembly of Parliamentary of the Mediterranean, and it's a pleasure. We have signed an agreement a few months ago, and so it's an important first step of our cooperation. I would like to say that this is also the sixth seminar that PLATFORMA is holding on EU development cooperation and how local and regional governments contribute to this end. PLATFORMA is a coalition of local and regional governments and their national, European and global associations active in cooperation development. The Council of European Municipalities and Regions, of which I'm the Secretary General, is the lead partner of this coalition and has signed a framework partnership agreement with the European Commission in 2015. The topic of today's discussion focuses on the impact of the COVID-19 pandemic, specifically in the Mediterranean region, which is the crossroads of three continents and their cultures in the context of promoting and safeguarding human rights. We also see the emergence of new rights related to digital technologies, in particular, that have proven to be crucial in these particular times of crisis, allowing local and regional governments to continue to offer essential public services, businesses to run, and keeping people connected to each other, while continuing to organize the main services needed. However, they should be based also on consent and trust, openness and transparency, fairness and inclusion, and social innovation to avoid an increase of the digital divide and discrimination. They must be people-centered. For the European Union, this region is included as our neighborhood south in the cooperation policies. Negotiations on the future instruments are now open, and the secure participation of local regional governments in this programming will be critical to respond to the global challenges the European Union and the South neighborhood are facing. We will examine during this seminar the human rights landscape, specifically at the local and regional levels in the region, and explore the interplay of actors at different levels of governance, specifically the role of parliamentary bodies across the region, as well as the role of cooperation and dialogue among and with local and regional governments. So again, I would like to welcome the speakers of the first block of discussion, which will set the scene from two perspectives, that of local governments and that of parliamentary institutions. So the first speaker is Mr. Harald Bergman, who is going to moderate this first block of discussion, and I'm happy to hand him the floor.
Thank you very much, Mr. Secretary General, for your kind words and your introduction. And good morning to everybody. I hope everyone is safe and well. And it's a pleasure for me as Mayor of the City of Middelburg from the Netherlands, but also as Congress spokesperson on human rights at the Council of Europe for local and regional authorities to address to you this morning about the topic human rights and its challenges. And of course, I would like to speak about and discuss with you about human rights all day, but time is limited. To me, it all starts with the question, why do we have human rights and how to use them? To me, human rights are inherent to all human beings, regardless of their legal status and as non-citizens, as refugees, migrants, or foreign residents, regardless of whether they are women, men, children, elderly, or have disabilities, and regardless of their religion, ethnic background, political views, or sexual orientation. I'm sorry. We all have the same basic rights and freedoms protected by law, simply because we are humans. Human rights are universal and egalitarian, so they are applicable everywhere and are the same for everyone at all levels of government. After the Second World War, states decided to define existing human rights concepts through written legal norms, leading to the adoption of the Universal Declaration of Human Rights in 1948 and hundreds of international human rights treaties and declarations in the following decades. From there on, an international human rights system developed. States develop and ratify treaties, laying down human rights and put in place international bodies that oversee their implementation, such as the United Nations, the Council of Europe, and the EU. And once a state ratifies an international human rights treaty, the human rights obligations therein have an effect as if they were national law. They are binding for the state, including all subnational authorities, and in relation to all people present in the territory. As we speak, a wide spectrum of human rights is guaranteed by law in each of our countries, next to international treaties, also our constitution, national legislation, and court decisions. Provisions such as prohibition of torture, freedom of expression, or the right of non-discrimination, all commonly referred to as civil and political rights. At the same time, there are also economic and social and cultural rights, such as the right to adequate housing, education, or healthcare. These provisions can be found in different legal texts, but in practice they are all of equal importance and they are all interdependent and interrelated. As we are all citizens, we all have rights and obligations. We may have to pay taxes, but at the same time the state provides us with services, grants us security, and ensures our rights or freedoms. Those rights correspond to the competence which are increasingly delegated from the state to local and regional authorities that carry them out under the principle of self-governance. So human rights are part of our competences and once translated into international obligations into practice. So where are those human rights aspects in yours and my daily work? Whatever the degree of self-governance in our countries, our competences are always correspond to human rights. Think about your competences, whether they are shared or autonomous, and try to identify policy areas that include a human rights notion. General areas could include housing, healthcare, education, security, and public order, or urban planning. And of course, this list of topics is endless. As from general to specific, we must not forget to look at the groups that require specific attentions, as they may face discrimination in accessing their rights or because their rights are simply more likely to be violated. One could think about children, elderly people, national minorities, and people with disabilities or migrants. So don't think of minorities as the others, but try to put yourselves in their shoes. When you've identified some competences and groups, see what some international human rights obligations can be translated to in practice, and especially now with the COVID-19 pandemic. It's likely to have long-lasting consequences on economic and social rights to prevent from the direct and indirect effects of the illness, people's cooperation with prevention efforts, and government transmission control policies. This pandemic has shown economic inequalities, especially in countries with fragile social protection systems, where vulnerable groups suffer crisis. COVID-19 has also highlighted inequalities in economic better countries, despite a good social protection system. People living in poverty are more likely to have health complications, live in crowded or poor quality housing, or on the street, and lack the resources to stay at home for long periods or follow hygiene recommendations. And also due to low-paid jobs, these people are often forced to choose between risking their health and even losing their income. There are plenty of interesting examples to mention. For example, about the social housing provided by Etterbeek local administration in Belgium. For the most vulnerable in times of the pandemic, we are talking about confinement and quarantine by requesting a hotel based in their municipality or on the right to welfare and social security, or even an example about Tbilisi municipal authorities in Georgia, delivering free dinners to socially disadvantaged citizens during pandemic and granting tax reduction to local businesses because of the lockdown. And I'm sure that you can think of many more in and around you live. So human rights are the same everywhere, but the conditions under which those rights are ensured naturally differ. A human rights-based approach means understanding the notion of human rights in our work and seeing the lasting impact that a rights-sensitive policy will have, not only for the immediate beneficiaries, but our inhabitants as a whole. Ensuring human rights does not have to mean costly policies or reforms. Think of organizing a one-day event, supporting a local association, or simply standing up and making a clear statement to the press. It can also have an immense impact. Even if human rights have never appeared on your agenda, you will surely already have implemented activities that concern human rights. Still, strengthening a right-based approach may feel for many like entering a new territory. Providing training, streaming internal communication, and exchanging practices with other cities or regional authorities, like today, can be crucial to overcoming problems. The decision to proceed with human rights tailored policies can of course also trigger certain political resistance. Clearly this relates above all the electorate. Receiving refugees in your city, designating housing for Roma, or organizing a yearly Gay Pride event may not be welcomed by everyone. So talk about these facts instead of prejudices and make sure you include your citizens in taking those decisions. That is crucial. Communicating the why and how of human rights policies together with the long-term benefits of such measures is also important. We are all from different parts of in and around Europe and sometimes not only have to deal with the same human rights related challenges, though each one of us also have to overcome the hurdles by implementing solutions. There is not one universal recipe, but exchanging experience is very often the most effective and least costly way of dealing with new topics of approaches requiring to human rights. I'm coming towards the last part of my speech to you, and it's about my work of the Congress of Local and Regional Authorities in Strasbourg at the Council of Europe in relation to human rights. Since the pillars of for the Council of Europe are the European Convention of Human Rights, and with European Court to oversee the implementation by 47 member states. It was also likely that within the Congress, we should do, besides implementing the European Charter of Local Self-Government, do more about promoting human rights on local and regional level. There cannot be local democracy without human rights, and that especially at local level. Think about stability, social cohesion, and efficiency of our policies are unlikely to achieve without considering the fundamental rights of our citizens. Therefore, we decided at the Congress in Strasbourg to work on the Human Rights Handbook. The handbook is a practical handbook that illustrates how embracing human rights in our policies can help our administration to respond to the local challenges. The first volume is about non-discrimination. This theme was chosen at the backdrop of the economic crisis, the refugees and the migrant flows, and the rise of political populism. The Congress decided to focus in the first edition on how to solve human rights-related challenges concerning refugees, asylum seekers, migrants, and internally displaced persons, but also Roma and travelers and LGBTI people. How can you find adequate housing solutions for refugees in your community? How can you improve school attendance rates of Roma children? What rights do gay, lesbian, and transgender people have? And how should those rights be integrated into your city, your town, or region? And last, how can successfully living together and social cohesion be promoted by local and regional bodies? The digital version of this handbook can be found at the website of the Council of Europe. And yesterday, in the remote meeting of my monitoring committee of the Congress of the Council of Europe, we agreed that the second volume of Human Rights Handbook, Social Rights, will be published within a few months. It also includes an entire section to how local authorities have responded in a dynamic way to increasing issues among the unfolding of the COVID-19 sanitary crisis that has effect on the right to health. It is this year the Council of Europe celebrates its 70th anniversary of the European Convention of Human Rights, and therefore we constitute a relevant Congress contribution to mark this anniversary. Thank you for your attention.
Thank you very much, Mr. Mayor, for this contribution and for also highlighting the role of the Congress of Local and Regional Governments and in the Council of Europe, a very important partner for us. Abbiamo il piacere di aver con noi la signora Iana Chiara M. Piacere, signora. Ms. M is a member of the Chamber of Deputies, the Italian Parliament, since 2018, and a member of the Foreign Affairs Committee of the Chamber. And she is also Vice President of the Assembly of Parliamentary of the Mediterranean. So I'm happy to give her the floor now.
Thank you very much. Good morning, everyone. Thank you for having us here. I think it's a crucial moment since it is a very particular moment for everyone. I am now here in Italy. Italy has had a very, very particular moment in this month. And I think that this first conference can pave a path for future and more collaboration. That said, it is a great pleasure to welcome you today here to this first joint initiative between PAM and PLATFORMA, and to take direct action on pressing humanitarian concerns in the Euro-Mediterranean region, while promoting multi-level governance, fundamental freedoms, and recovery solutions. This newly established partnership between PAM and PLATFORMA, which brings together local administrations and parliamentarians for a constructive dialogue in our region, represents the sustainable response, planning required to ensure fundamental freedoms, good governance, and recovery solutions. Establishing a direct dialogue between local authorities and parliamentarians is essential to promote a common understanding of critical issues that need to be addressed through coherent and complementary strategies, including sharing best practices. Dear colleagues, Local administrations and governments have been and are still at the forefront of our systems in ensuring assistance to those in need. Emergency food distributions, health assistance, and social services, including the management of schools, are indeed your responsibility. National systems depend on your capacity to deliver also in exceptional circumstances, as in this case with COVID. It is the duty of national parliaments to support you and also to ensure cross-border cooperation as a result of the globalization of our societies. As we all know, the COVID-19 pandemic has set an unprecedented urgency for parliaments and international organizations to adopt public support systems in all aspects of our society. This crisis also renewed PAM's commitment to addressing injustices in education and health systems, gendered violence, and migration rights, especially during a state of emergency. During the COVID-19 pandemic, exceptional measures have been taken to ensure that response meets the needs of those segments of population who usually fall outside of standard social safety nets. Joint initiatives have also been established with the private sector and civil society organizations to reach the most vulnerable people. Countries have been able to react rapidly and adopt high level of adaptability to cope with the social aspects of the crisis. Of course, the legal argument for those temporary restrictions on rights has been determined by the overwhelming scientific data on the coronavirus to slow down its spread. However, it is important to reiterate that in any case, its actual limitations should not be confused with a total suspension or suppression of core and constitutional and civil rights. Unfortunately, it has become evident that the predisposed inequality in the education system between genders and for migrants has intensified due to the exceptional situation. Those closures of schools to mitigate the spread of COVID-19 has exposed structural challenges such as access of digital learning, access to childcare, internet, disability services, food insecurity, homelessness. Many children rely on school for food stability and for a safe environment. Otherwise, many parents rely on schools for childcare during their busy workdays. And hence, without computers and internet, students, particularly those in need and from low-income households, were really unable to participate in a more dynamic forms of distance learning. Primary needs, such as an access to food and shelter are of concerns, in addition to providing quality education to students despite accessibility challenges. As the COVID-19 pandemic has unfolded, it has been clear that there is considerable stress on education systems, which requires vocational training and opportunities and urgent adaptation for health codes, especially now that schools have opened. And I want to remark here also thanks to all the teachers who have had and who have made all efforts possible to ensure education accessible to everyone. The COVID-19 outbreak has also intensified domestic and gender-based violence against women globally. Pre-existing toxic social norms and gender inequalities, economic and social stress caused by the pandemic, coupled with restricted movement and social isolation measures, have led to an exponential increase in gender-based violence against women. NGOs and helplines and PAM members and partner states have reported a general 30% increase in domestic violence cases during the implementation of quarantine measures. Women seeking help may face stigma from the police, especially if they are women in the LGBTQ community, elderly, young, migrants, refugees, racial or ethnic minorities, or have disability. Women who are exposed to domestic violence face mental health challenges for the rest of their lifetimes. Future policies should prevent those cases, intervene in cases, and evaluate policies against domestic violence. I am also glad here to inform that PAM is working thoroughly on a dedicated report on domestic violence with key recommendations to be implemented at national and on local levels. The COVID-19 pandemic deeply affected also migrant and refugees. Many reception centers and refugee camps were in the first place not well equipped or suited to allow for special measures to contain COVID-19 and experienced difficulties ranging from overcrowding, poor sanitation. Amongst this challenging, children in these camps faced barriers to receiving quality education remotely and access to digital technology. Migrants and refugees from women are also faced gender-based violence and domestic violence routinely during the migration and in their respective host countries. Our Assembly promptly encourages member and partner states to protect migrants and refugees within the context of national education systems and the domestic violence crisis. In response to the humanitarian crisis in Greece and in Turkey, which we have seen recently, PAM, along with the UNHCR and IOM, urged the EU to adopt policies which would provide international support to countries protecting migrants and refugees. In the development of national health plans, PAM encouraged member and partner states to incorporate protections for migrant and refugees, victims of domestic violence, and also students. PAM issued many reports and press releases on education, on migration, on domestic violence, also on climate change, food security, among others. Although I have raised humanitarian rights violation in respect to the education system, gender equality, and migrant rights, of course, there are many other challenges which exist between and outside these topics. In the post-COVID-19 context, the implementation of international human rights law should exactly match the reality of how people are being protected, especially those in the most vulnerable situation, in a multi-sectoral approach. The solutions will need to address structural inequalities as well as meeting immediate needs for sustainable recovery in the post-COVID-19 context. The COVID-19 pandemic has exposed the direction of where our work must lead, specifically addressing historical inequities in education system between genders and for migrants and refugees. The partnership between local and regional governments and parliaments in a national and international capacity is the key to address the human rights challenges and inequalities and jointly safeguarding, promoting, and advancing the human rights agenda around the Mediterranean basin. PAM is strongly committed to this partnership with PLATFORMA, and I really hope to have more initiatives which will take place in the near future. And in this case, of course, I look forward for hearing the presentations and of course of our keynote speakers and to engage afterwards in the following debate. Thank you very much.
Thank you very much, Ms. M, and thank you for these inspiring questions and words. And that leads us to the first panel debate we will have. Et c'est un plaisir d'accueillir les prochains panélistes. Et d'abord, Madame Maria Arena, qui est députée européenne, présidente du sous-comité sur les droits humains, représentant la Belgique au Parlement européen. Je suis content d'abord de l'accueillir parce que c'est vrai que c'est quelqu'un qui connaît bien les gouvernements locaux et qui a beaucoup travaillé aussi avec les gouvernements locaux. Monsieur Ammar Moussi, qui est membre du Parlement de l'Assemblée nationale algérienne. Bienvenue, Monsieur Moussi, et qui est rapporteur sur la migration au PAM. Monsieur Moussi remplace un speaker qui avait été annoncé mais qui n'a pas pu nous rejoindre, Monsieur Cozzolino. Donc je le remercie d'autant plus d'être avec nous ce matin. Et puis Monsieur Mukesh Kapila, qui est professeur sur les affaires humanitaires et la santé à l'université de Manchester. Welcome, Mr. Kapila, et qui est l'ancien directeur des réponses d'urgence à la World Health Organization, et qui est un conseiller de l'Assemblée parlementaire méditerranéenne. Donc, je suis heureux de vous accueillir tous les trois et de vous donner la parole et d'abord d'inviter Madame Arena.
Merci. J'espère que vous m'entendez, que vous me voyez.
Tout à fait.
Merci, merci beaucoup. Mais tout d'abord, merci pour l'organisation de cette rencontre. C'est vrai que les rencontres en vrai, en live, permettent d'avoir des échanges plus humains. Je dois avouer que je préfère ce mode d'organisation, mais dans le contexte qui est le nôtre et de la Covid-19, je pense qu'il est essentiel de pouvoir utiliser toutes les technologies pour continuer à parler de la question des droits humains. Je dois d'ailleurs dire qu'au Parlement européen, il avait été pris comme décision de ne plus avoir d'urgence en matière de droits humains dans les plénières. Et j'étais particulièrement choquée par cette décision. Et la dernière plénière, on a réussi à remettre à l'ordre du jour les discussions sur les violations de droits humains dans le monde. Et je pense que c'est important parce que la Covid-19, non seulement ne peut pas effacer les défis auxquels nous étions confrontés avant la pandémie, mais surtout…
Madame Arena, vous avez éteint votre micro.
Ok, je réactive.
Voilà, merci.
Voilà. La pandémie a montré que les endroits où les libertés fondamentales étaient déjà extrêmement réduites, la pandémie a renforcé effectivement ces dérives autoritaires. Et donc, il était pour nous essentiel de pouvoir reparler et remettre en priorité ces questions de droits humains. Alors, juste pour planter le décor au niveau de l'Union européenne, je pense qu'on est confronté aujourd'hui, dans le cadre de la Covid-19, à une toute première priorité qui est de pouvoir remettre à l'ordre du jour les questions des solidarités internes à l'Europe et externes à l'Europe. Et pour ça, les autorités locales ont un rôle extrêmement important à jouer parce que ces solidarités s'organisent au mieux dans le niveau le plus proche des populations. Est-ce que cela veut dire que l'Union n'a rien à faire? Non. Et d'ailleurs, nous sommes en train de discuter aujourd'hui sur le Next Generation Fund, qui est 750 milliards d'interventions aujourd'hui par l'Union européenne auprès des États membres. Et je trouve que le rôle des collectivités locales dans, je dirais, l'utilisation de ce levier de moyens est absolument à défendre. On l'a vu dans le cadre de la gestion de la Covid-19, c'est grâce aux collectivités locales qu'il y a eu une meilleure réponse, tant en termes de santé, mais aussi en termes de solidarité par rapport aux populations les plus fragilisées, c'est-à-dire celles qui sortent du radar. On a parlé tout à l'heure des personnes migrantes, par exemple, mais aussi on peut parler des sans-emploi, on peut parler dans des territoires de personnes qui vivent de l'économie informelle. C'est au niveau des territoires que la meilleure connaissance de ces réalités existe et donc les territoires doivent pouvoir bénéficier de ces 750 milliards d'euros qui vont arriver au niveau des États membres. Et donc ça, je pense que c'est vraiment quelque chose sur laquelle on doit absolument insister. La deuxième priorité, c'est bien entendu de pouvoir aller attaquer les défis qui étaient présents hier, mais qui doivent être vus avec la nouvelle, je dirais, logique de cette pandémie. Alors, j'ai cité, et c'est assez subjectif de ma part, mais j'ai cité 5 défis importants qui existaient, mais qui devront être ajustés par rapport à la pandémie. Alors, vous ne serez pas étonnés, la question de la transition écologique est un défi qui existait et qui devra se saisir de cette pandémie comme une opportunité pour pouvoir renforcer, accélérer les mécanismes qui avaient été mis en place. Et là aussi, les collectivités locales sont extrêmement importantes dans l'exercice de cette transition écologique. La deuxième priorité, c'est la question de la recherche et développement et de la santé. Je pense qu'il est essentiel qu'on ne puisse plus en Europe être dépendant des chaînes de valeur, tant en matière de recherche, mais aussi en matière d'approvisionnement santé, tel qu'on l'a été aujourd'hui. Des vaccins qui aujourd'hui des molécules qui aujourd'hui ne sont plus présentes en Europe, mais sont présentes en Chine, par exemple, nous mettent dans des situations extrêmement fragiles. Alors qu'on a des territoires qui sont en capacité, je dirais, de produire ces connaissances et de produire aussi, j'entendais ce matin qu'une collectivité, une région française a pris en charge la production de masques qui n'existaient plus en Europe depuis des années. Et donc, c'est au niveau des territoires que cela est en train de se faire. Le troisième défi, c'est bien entendu les emplois et la lutte contre les inégalités, parce que oui, on va perdre des milliers d'emplois. Les 750 milliards qui sont mis sur la table, c'est pour recréer des nouveaux emplois. Quel type d'emploi? Quelle est la qualité de l'emploi qu'on va pouvoir créer? Et dans quelle région on va pouvoir les créer? Parce qu'on ne peut pas créer des déserts économiques. Et donc là aussi, l'enjeu de la création d'emplois et des territoires sont importants. Le troisième défi, c'est la question de l'état de droit. Et on a vu, tant en Europe qu'à l'extérieur de l'Europe, des fragilités importantes. Je parle de l'Europe, par exemple, en Pologne, où on a vu des communes qui se sont déclarées LGBTI-free. C'est quelque chose qu'on doit absolument combattre. Et là aussi, la question des territoires est extrêmement importante, en dehors de l'Europe également. Et enfin, la question de l'Union européenne et la globalisation. Quel est le rôle de l'Union européenne dans cette globalisation? Le commerce, la politique extérieure, les alliances stratégiques, le multilatéralisme, et vraiment sont des enjeux importants. Et si vous prenez ces 5 défis, la question des droits humains doit être une des priorités. On pense souvent à la recherche et développement, on ne parle pas suffisamment de la question éthique de la recherche et développement. Si on prend par exemple la recherche et développement en matière d'algorithmes, on n'a pas suffisamment mis la question des droits humains dans cette recherche et développement et on voit les résultats, c'est-à-dire qu'on est soumis aujourd'hui à devoir courir après les groupes tels que Google et Facebook pour leur imposer quelque chose, tout simplement parce qu'on n'a pas régulé au départ la question de la recherche et des droits fondamentaux. Et donc, dans ces défis, il me semble, donc, ces défis sont traversés à la fois par la question des territoires et le rôle que les territoires doivent avoir, mais également par la question des droits fondamentaux. Alors, plus précisément, en ce qui concerne la Méditerranée et le partenariat sud qui nous occupe aujourd'hui. Dans le cadre de la globalisation, je pense qu'il est essentiel que l'Union européenne relance une stratégie avec son partenariat sud. On le voit aujourd'hui, ce qui se passe en Méditerranée avec la position de la Turquie, par exemple, nous ramène à la question des droits humains. La Turquie est un pays qui viole aujourd'hui les droits humains. On a eu cette juriste qui est morte en prison il y a 2 semaines, tout simplement parce qu'elle demandait un procès équitable. Et la Turquie n'a pas été non seulement en mesure de lui offrir ce procès équitable, mais n'a pas été en mesure non plus de la sauver par rapport à la situation qu'elle avait en prison. Idem en Libye. Aujourd'hui, le partenariat avec la Libye était extrêmement difficile et nous devons effectivement travailler sur cela. Mais nous aurons aussi des difficultés et je suis heureuse de voir que nous avons un panéliste algérien aujourd'hui avec nous. La discussion que nous avons aujourd'hui avec l'Algérie sur la question de la liberté d'expression et l'emprisonnement à 2 ans de prison d'un journaliste aujourd'hui en Algérie nous pose effectivement difficulté par rapport à la question de la liberté d'expression avec nos partenaires du pourtour Méditerranée. Et donc, on doit travailler ensemble pour essayer de trouver des zones de consensus sur ces standards en matière de démocratie, en matière de liberté d'expression. Idem sur le pourtour Méditerranée quand nous allons travailler sur ces questions de transition écologique. La Méditerranée est un endroit où la question des énergies renouvelables est peut-être une priorité. Comment l'Union européenne peut soutenir par le biais des programmes de développement, de recherche en commun avec les pays du pourtour Méditerranée pour accélérer cet accès à la transition écologique. La migration, bien entendu, Vous savez qu'aujourd'hui, l'Union européenne est en train de penser, la Commission va venir avec une proposition du pacte migratoire. Ce pacte migratoire ne peut être efficace que si nous avons un vrai partenariat avec les pays du pourtour de la Méditerranée. Nous ne pouvons pas, je le dis clairement, sous-traiter la question migratoire aux pays qui sont les pays du pourtour méditerranéen. Nous ne voulons pas que ces pays deviennent des Moria tels que nous les avons aujourd'hui en Grèce. Nous devons ensemble travailler sur les standards de la migration et ensemble résoudre cette question de la mobilité. Je suis à titre personnel favorable à ce qu'on appelle les mobilités circulaires, aux migrations circulaires, donner plus de visas, donner plus d'opportunités à des étudiants de venir étudier, de rentrer pour le bien de leur pays. C'est vraiment quelque chose que nous devons construire ensemble au niveau de la migration. Et enfin, en matière de Covid, sur l'urgence sanitaire, vous savez, et tout le monde le sait, la Covid ne s'arrête pas aux frontières. Et si on veut réaliser un vrai espace entre l'Union européenne et le pourtour méditerranéen, eh bien, nous devrons travailler ensemble aussi sur les questions d'urgence sanitaire, tant sur l'aide que l'on peut octroyer aujourd'hui aux pays du pourtour méditerranéen, mais aussi sur la recherche à venir par rapport à ces besoins. Et donc, tout cela, vous le voyez, dans le cadre de la Commission aux droits de l'homme, nous y avons travaillé, nous avons eu énormément de sociétés civiles qui sont venues parler des situations qu'elles vivaient dans leur pays d'origine. Nous avons rencontré aussi beaucoup d'autorités liées au pays d'origine pour pouvoir travailler ensemble sur ces défis. Ce n'est pas simple, tant à l'intérieur de l'Europe qu'à l'extérieur de l'Europe, et je le dis souvent, tant que nous aurons des pays en Europe qui ne sont pas au standard de respect des droits de l'homme, nous aurons la difficulté de défendre ces droits de l'homme en dehors de l'Europe également. Et donc, balayons devant notre porte avant d'essayer d'avoir des alliés en matière de droits de l'homme à l'extérieur de l'Europe. Merci.
Merci beaucoup, Maria Arena. Et merci d'avoir balayé un champ très large de questions, mais c'est vrai qu'il y en a beaucoup à traiter. Et certainement, ce qui nous paraît extrêmement nécessaire, c'est la construction d'un partenariat entre tous les niveaux de gouvernance pour relever tous les défis que vous avez évoqués. Et s'il y a un défi aujourd'hui qui est aussi au cœur de nos réflexions, c'est celui de la migration. Et Monsieur Moussi, qui est rapporteur sur ces questions à l'Assemblée parlementaire méditerranéenne, va pouvoir nous éclairer. Mais je voudrais dire, avant de lui donner la parole, que le Conseil des communes et régions d'Europe est engagé dans un programme Inclusities qui est cofinancé par l'Union européenne et qui permet d'étudier et d'échanger au niveau local sur la manière d'intégrer et d'inclure les migrants et notamment les réfugiés dans la vie locale. C'est un sujet très important, mais que souvent les États revendiquent comme étant de leur responsabilité, alors qu'on sait bien que c'est au niveau local que ça se passe. Et la crise dramatique qui se produit à Moria, à Lesbos, montre aussi que on laisse trop souvent les collectivités territoriales seules face à des situations qu'elles ne peuvent pas gérer toutes seules. Et je connais beaucoup de maires en Europe qui sont volontaires pour accueillir des réfugiés, des migrants, mais malheureusement, les règles en vigueur ne permettent pas de les associer pleinement à cette politique. Donc, Monsieur Moussi, je vous donne la parole. Je suis heureux de vous accueillir. Donc, the floor is yours, comme on dit. Ah, on n'entend pas Monsieur Moussi. Est-ce que quelqu'un peut m'aider? Boris? Ah, Monsieur Moussi, il faut ouvrir votre micro, je crois.
Oui.
Voilà, très bien.
Thank you.
Welcome.
Dear colleagues, good morning, everybody. I am pleased to join you in this timely and important discussion regarding the impact of COVID-19 on human rights protection. I wish to congratulate PAN and PLATFORMA for organizing this important webinar. As COVID-19 epidemic has been able to spread all over the world and, of course, over the Mediterranean, governments have put in place restrictions, measures to limit the diffusion of the virus. Surveillance on private citizens were also expanded. And in some countries, the army was deployed to enforce COVID-19 mandates on citizens. While the aim of the external restrictions on movement was generally to protect the health of the population, excessive restrictions may have led to violence or violation of these rights. Many countries introduce enforcement measures to discourage breaking of lockdowns and quarantine. Some with extreme punitive measures, including imprisonment or extremely high fines. They have adopted numerous pieces of complex legislations of both central and local levels, most of the time with little or no public debate, resulting in a large degree of uncertainty for the general public. Some restrictive measures even result in some cases in indirect discrimination, causing unequal treatment on certain groups. These restrictions changed probably the way we live our life and our enjoyment of fundamental rights. The major change the states are facing show to balance their ability to respond effectively to this crisis with ensuring that the measures taken do not undermine the protection of human rights and fundamental freedoms. In this exceptional situation, it is difficult to draw the exact line between what is necessary and fair and what is not. In times of such crisis, parliaments have a duty to ensure that emergency measures are implemented properly and in accordance with international standards, that restrictions of freedom are proportionate and proportional, that economic relief funds are distributed where they are needed, and that security and stability are upheld. We, as parliamentarians, play a key role through our role in legislation, oversight, accountability, and budgeting and advocacy. We need to ensure that the rights of the people that are living in various conditions are taken into consideration, by ensuring that always they have all the material and psychological support they need. However, upholding and promoting human rights is not something that parliaments and government can do alone. The cooperation and consultation between parliaments and local and the regional authorities are needed more than ever. Indeed, the local dimension has a special significance, since it is the one that is closest to the people and has direct contact with them. A multi-level system allows decision makers to be always directly in contact with the local population, to which the human rights protection activity address, as well as to refine and correct the human rights protection strategies that has been implemented in a specific manner. As the COVID-19 pandemic continues to change our societies, its regional and local impact is still undefined. While the future is uncertain, one thing is clear: we need to plan our recovery, and we must ensure that our societies will be better than before. To do so, three priorities areas are the action three priority areas where the action of local and regional government can make a difference should be addressed. First one is the administration, social and health services. In the region that have been particularly affected by the pandemic, the resources that will be used for the recovery must be distributed following the local needs. For that, we need to ensure that the right of local authorities to prevent an unfair allocation of resources between local population by being a key actor in organizing their distribution. The second area where action of local government is crucial and is the economic recovery. Local authorities have been directly exposed to the economic consequences of the pandemic. They have experienced directly the restrictions that were put in place to limit the diffusion of the virus. Consequently, it is key to consult them as a reliable source of proposal and ideas that will serve as a base for fostering and the economic recovery for COVID-19. We need to empower governments, making them responsible for identification of concrete projects and plans that could encourage the economic development of the region. I am convinced that decentralization is directly linked to strong interaction and cooperation between the parliamentarian and local government representative, as well as among the all stakeholders. We need effective consultation, openness, transparency in state of material governance. These consultations can give local authorities a better understanding of the overall responsibility of parliaments and governments for the whole public sector. Last, but definitely not least, we need to work on the digitalization of our societies. During the pandemic emergency, we have been positively surprised by local authorities' intense use of new technologies to limit the negative effect of the restrictions that were imposed to limit the diffusion of the virus. So it is important to ensure the local and regional governments will drive profoundly the future acceleration and adoption of new technologies, such as the 5G systems, to benefit communities. This process of digitization will boost their economic recovery, create new jobs, and enhance the resilience of our society. Finally, we cannot forget that vulnerable groups are more exposed to the crisis. We must urgently strengthen the mechanisms to support them and to limit future situations of discrimination or economic difficulties. To make a small remark, of course, I'll give the Algeria experience during the discussion a bit later, but just a small remark for our colleague. When Maria Arena, when she spoke about a journalist who is a giant for cares, that freedom of speech does not mean to be a troublemaker and call people to revolt in this special situation. Thank you, and we'll give the Algeria experience later on during the discussion. Thank you very much.
Thank you, Mr. Moussi. Just a remark on your last point. Sometimes troublemakers are important in democracy to make things move up, and it's also a part of the development that we like. But you mentioned something that is very important. It's decentralization, and Algeria is in a transition period now. And certainly the call of the youth in Algeria, like in many other countries, is to have more capacity to influence their own life, and decentralization is a way also to give to the citizens more possibilities to decide on their own life in their community. So very very important. Thank you very much, Mr. Moussi. I turn now to Mr. Kapila Mukesh. Mr. Kapila is, as I explained earlier, professor of global health and humanitarian affairs at the University of Manchester. He is a former director of emergency response at the World Health Organization and a senior medical advisor of the Parliamentary Assembly of the Mediterranean. Mr. Kapila, I'm happy to give you the floor.
Thank you, Mr. Chairman, and hello, dear friends. Let me try and complement the remarks already made by focusing on the health-human rights interface. I think the principal argument for a human rights framework in the management of pandemics like COVID is that it's the better way to manage a public health problem. I think all through history and time and experience, ever since the ancient Venetians did quarantine when they had a plague many hundreds of years ago, it's been realized that voluntary measures for disease control are always more effective than coercive measures. And it may be that authoritarian regimes or authoritarian ways of working may achieve short-term gains, but always, and there are no exceptions to this, in the longer run, a disease is only conquered by the voluntary cooperation of people. And that, of course, means absolute respect for human rights. And the corollary of that is, and this is the corollary of health, is that health is ultimately an individual attribute, which means that the actions have to be most local and personal. So those of you who are legislators in national parliaments and local parliaments and international sphere have got to understand, and I'm sure this is why we are here, and this is why this association exists, is the importance of combining the global, the international, and the local in the forms of governance, which is the kind of title for this particular session. Having said that, let me also qualify, and that is, by definition, the public health is in competition with individual health at some level. Because to maximize public health necessarily means placing some limitations on the pursuit of health of the individual. Because arguably, of course, you cannot achieve public health unless all individuals are healthy by definition. However, there are cases, and COVID is a classic example, where you have to limit the achievement or the freedoms of people in order to maximize the collective freedoms or the collective health of people. And that, of course, is where the dilemma actually arises. And this is why there's a great deal of debate on this particular subject. Now, I think there is another dimension which people need to think about, and that is science is not absolute. And public health is science-based, but it is also based on making professional judgments. And let me use the example of forthcoming vaccines to illustrate my point. And this is going to be very much on your agenda as legislators, and this is going to be a controversial issue in the period ahead. Now, we know that we hope we will get a vaccine soon, but that's no guarantee that will be the case. And it's almost certain that the first generation of vaccines are not going to be 100% effective. In fact, the current generation of vaccines that we have every year for flu are, if you're on a good year, you will be 60 or 70 or 80% effective. Now, WHO has said that they will accept vaccines they will certify vaccines which are only 50% effective, which means that the first generation vaccines may probably only have give of 2 people who take the vaccine, one will be covered and the other may be unlucky and vaccine will not work. We hope it will be better than that, but it cannot be guaranteed. Now, at the same time, we know that that all medical interventions have side effects. So we also know that, and this is why we have clinical trials that are currently taking place, and there are well-publicized stories that that the vaccines under test they are having side effects, and the purpose of clinical testing is to identify serious side effects. But we also know that some side effects are only identified after many years and after very millions of people have taken them, because the rate of side effects, or serious side effects, is very small. So it may well be that there will be side effects detected, not in the clinical trials that are currently taking place, but it might not be detected until, say, 10 million, 20 million people have been vaccinated normal purpose. So hold that fact, hold that the possibility. Now, the third issue is how many people need to be vaccinated for the public health to be protected. So the general kind of calculation is that somewhere in the region of 60 to 70% of the public will have to be protected in order for all of us to be protected in the best way possible. So think about it. A vaccine which is 50% effective has to be given to at least 70% of the population in order to have a chance to try and cover the people who are not being vaccinated. And there are a number of reasons not to be vaccinated, because there'll be people out there whose personal bodily condition is such that the vaccine is not indicated for medical reasons. But more important than that is the growing problem of the vaccine hesitancy and anti-vaccine movement. And it's very, very important, the role of legislators like yourself, lawmakers and influential people, to be now preparing the ground to educate people about the benefits and risks of vaccines. In the end, you know, the management of COVID-19 is about the management of risk. And that also means it's a management of human rights, or the balance of human rights as well. Now, you know all this, you see, but let me try to illustrate. Because the issue that's going to happen, that is going to be coming up for debate in all our countries, is that when there is a licensed COVID vaccine, should it be compulsory? And lawmakers, like many of you, will have to consider whether or not you pass legislation that makes it compulsory to have vaccination. This is not a new subject. We've had that with other vaccinations in the past, but in developed countries, the richer countries of Europe, the proportion of people who are even now saying that they're not going to have a vaccine, even if one comes along, is very high. It's at least 30%, if not more, in certain communities. So put this against the other numbers that I've quoted, and you will see the problem we're going to face. Now, in that context, what is the role of human rights going to be? Do we force people to have a vaccine, knowing that there's a chance of side effects, and knowing that it may not be effective anyway, if you like, but knowing also that unless we maximize the number of people having a vaccine, which may not be perfect, but it's still better than nothing, we might be able to actually enjoy other human rights, like, for example, keep the schools open, like, for example, people going to work and have a livelihood. That, my dear friends, is the dilemma to which I think there has to be a solution based on principles, because science is not going to help you. Neither is public health going to help you. And of course, depending on the values of a nation and the values of a region, I think a judgment will have to be made in that regard. Let me just go away from the topic to talk about other dilemmas in the interface between public health and human rights. And of course, some of them are already familiar. We already know that many doctors and nurses died during the course of providing clinical care for people with the coronavirus. Now, what about then if doctors and nurses say well, I'm sorry, I'm not going to do my duty and treat patients unless I have this PPE, that protection, those conditions at work, and so on and so forth. What then are the rights of that doctor or nurse vis-a-vis the right to receive health, which is a fundamental part of universal rights? Now, can we coerce the healthcare worker to provide healthcare? And it may also be that even if absolute safe conditions are prevalent in a hospital, there are full personal equipment and good hygiene conditions, etc., but the doctor or the nurse may be in a high risk category. They may have diabetes, they might be older, they might be, have other underlying factors. So you can see immediately that there is a conflict of issues here. And of course, doctors, like when I worked in clinical sphere, we were well familiar with the dilemma of how to share limited resources between people. So for example, as already faced by doctors in hospitals in many countries, if two people need a ventilator and there is only one ventilator, how are you going to decide who's going to benefit and who's going to die? Now, there are clinical criteria for doing that. Obviously, the answer is that you will give the ventilator to the person who is most likely to benefit from it, if you like. And yet, in many countries, the proxy criteria for the principle is the age of the person. So if a person is older, they're less likely to receive a ventilator treatment than if a person is younger. So immediately you're discriminating people on the basis of age, which you're not supposed to do. And you can, I think, understand the argument that I'm trying to develop. So therefore, dear friends, the real issue in the human rights health interface is how do you apply these principles that we've talked about, on which we have huge international frameworks and national agreements and international agreements. And that, I think, I don't want to repeat, in the practical circumstances that we are going to find ourselves in. And I would suggest that to that there is, the answer is that there is a specific answer, but there is also a universal answer. I mean, the specific answer is to say, oh, well, each problem will have to be solved according to its own context. So in Morocco, you might do things differently compared to Belgium, because the circumstances are different. It's easy to say that. But then what about the universality of human rights? And also depending on what kind of government you have, it obviously means that the interpretation of a context is going to be different. So it's going to be a lottery. A person in one country vis-a-vis a person in another country is inevitably going to be faced with a lottery of life and is not going to be protected by any of these international frameworks and norms that we are talking about. So I think one of the things to promote in our approach to this, because there isn't a magic answer, there isn't a perfect goody answer to this, is that if any measure of coercion is sought, if any compulsory coercion is asked for in any public policy, whether it is whether or not people should have vaccines in the future, I think the issue is going to be about whether or not the science is good enough to justify the degree of coercion. Take the case of face masks. Now, we know that face masks are probably good, but the science on the use of face masks is still a little bit dodgy, and WHO got a little bit pressurized to say, oh yes, you should wear face masks. And I think we probably should wear face masks. But Sweden has decided that face masks, the science behind face mask use is not so good as perhaps other measures. And the track record of Sweden is better than many other countries. So the point about lawmakers is that they should not hide behind the nearest available convenient science, because the science is not exact. And the science is variable, and the science depends on which scientists you have in your pocket to give you the answer that you need. And we have many examples of where public policy is made by governments on the basis of their favorite scientists who tell them what they want to do. Just be aware of that. But when science is not exact, and I would submit that in the case of COVID-19, the science is not exact. It's not exact in terms of prevention, it is not exact in terms of control, and it's not going to be exact in terms of the measures ahead that are going to be required to control the next phases of the pandemic. Then I think the answer probably lies in trying to be much more flexible and much less coercive. So to answer my own questions, I think we have to teach people to live with risk. And that is, if a person doesn't want to be vaccinated in the future, there is no space for law to go and tell the person to be vaccinated, especially as we know that the society may not be able to pick up some of the negative costs of a vaccine, or people who have vaccines and suffer side effects. Final example on this, what do you do with children? So a parent may say, I don't like vaccinations because my religion tells me I shouldn't do this, or I have a deeply ingrained views, intellectual views or philosophical views that I'm against vaccination. Fine, we are supposed to respect such beliefs. But what about the child of that person on whom is then imposed the views of the parent? Now that child, who presumably is an autonomous person also, but not an adult, is then subject to the authoritarian views of their own parent, if a way. Should the application of human rights actually say that parents should not impose their anti-health protection views on their children because it infringes the rights of the children? In any case, the children have to go to school, and an unvaccinated child might actually make an elderly, an older teacher sick, etc., etc. You get the arguments. So let me conclude there by saying that in the Parliamentary Assembly of the Mediterranean, these issues, many of our friends there and colleagues are raising that in many, many countries. And so what we are planning to do is to have a program, a course, if you like, or a series of seminars to address the issues of global health, human rights, and pandemics, and tackle some of these questions in a very, very practical way. I mean, the fact is that in the old days, when I was young and worked initially as a doctor, and then in public health, and then in government as a health policy maker and a general public policy maker, life was easy because I was the expert. And in those days, people kind of trusted experts. But today, everyone is an expert. So and when it comes to health, everyone is a doctor. And the days of the global dissemination of information, including fake news, everyone has an opinion on it. So what that means is that this subject of health, human rights, pandemics, COVID, is far too important to be left just to experts, whether they're health experts or human rights experts. And that's why I think it's very, very important that everyone becomes an expert, but an informed expert, if you wish, in global health. Today, in the way that everyone should know how to read and write. Similarly, I think in terms of literacy on this basic subject of making choices, including choices that impact on others, it's the duty of everyone to become an expert. So it's in that spirit, I think, that PAM is going to inaugurate a series of seminars to ensure that everyone who is a member of PAM, whether they're a parliamentarian in any of the member states of PAM or associate states or the staff, become an expert, so that they in turn can make sensible policies and legislation. And I very much hope that you will all join in. Thank you.
Thank you very much, Mr. Kapila. Thank you for this interesting views on expertise. I have the feeling that if everyone wants to be an expert or pretends to be an expert at the same time, more and more people don't believe the real experts, and that's the problem. So thank you very much. Unfortunately, we are running out of time. I don't know if we have any one who wants to react. Maybe I can invite my colleague, Jean-Pierre Elong-Mbassé, who is Secretary General of United Cities Local Governments in Africa, to react, but I think that will be the only reaction before we go to the next session. Jean-Pierre, tu veux réagir?
Merci beaucoup, Frédéric. Je suis extrêmement éclairé par ce que je viens d'entendre et je pense que Monsieur Capilla, en particulier, nous a soulevé des problèmes de nature presque éthique par rapport à la réaction vis-à-vis des droits humains que pose la COVID-19. Et je pourrais même étendre ce qu'il dit parce que cette réaction, elle s'applique ici à ce que j'appellerais les Athéniens, les gens qui sont citoyens reconnus par leur communauté. Et elle s'applique moins aux plébéiens, les gens qui ne sont pas reconnus comme citoyens dans leur communauté. Je pense en particulier aux gens qui sont exclus du radar, qui sont les migrants. Et nous sommes dans le voisinage sud de l'Europe où la question de la migration est une question qui est lancinante et que les gens abordent de manière inquiétante. Nous attirons l'attention sur le fait que lorsqu'il y a des mesures prises à la Covid, comme on l'a fait, moi je suis au Maroc, on a vu que le gouvernement marocain a pris des mesures très très fortes pour soutenir les populations les plus vulnérables. Sauf que on a oublié les migrants. Et les migrants sont un maillon faible. Et dès qu'il y a un maillon faible dans une société, eh bien, toute la société est affaiblie. Et donc, on voudrait que les parlementaires regardent bien, surtout sur ce voisinage sud, l'extension de ces réflexions sur les populations qui n'ont pas tout à fait les mêmes droits que les autres et qui sont parfois en dehors du radar des parlementaires et qui pourtant participent de la vie dans les sociétés du voisinage sud de l'Europe et qui devraient faire l'objet de plus d'attention parce que le fait de ne pas faire attention à elles affaiblit tout le front de lutte contre la Covid. Et ces populations-là n'ont bénéficié pratiquement d'aucun soutien à leur survie, ont été interdites de sortir comme les autres et ont eu des déboires post-Covid et durant Covid qui sont très importants parce que ils n'ont eu aucune couverture. Alors j'appelle l'attention des parlementaires sur cela et je pense que tout ce que M. Capilla nous a dit sur les droits et sur les sortes de dilemmes dans lesquels nous sommes en train d'aller doit également s'appliquer aux populations migrantes. Voilà ma première réaction.
Merci beaucoup, Jean-Pierre. Merci aussi pour cet éclairage sur, évidemment, la question si importante de la migration, mais qui mériterait d'avoir à elle seule une session complète, et je pense qu'on l'aura dans les prochaines semaines. Je vais me tourner maintenant vers Boris Tonhauser, qui est donc conseiller à PLATFORMA et qui va modérer la dernière partie de cette session en remerciant encore une fois nos trois intervenants, Madame Arena, Monsieur Moussi et Monsieur Capilla, pour leur présentation qui, je crois, ont été très appréciées d'après ce que j'ai vu sur le chat. Et vous pouvez bien sûr utiliser le chat pour commenter et éventuellement poser des questions également. Donc, merci à vous trois. Et je suis heureux de passer la parole à Boris pour la suite de cette matinée.
Thank you very much. Merci. Thank you, Frederic. And thank also to all the other speakers who have set a great scene to the conditions and to the challenges that we face in this aspect. And I would like to welcome the 4 speakers of the last block of the webinar, which is dedicated to inspirational examples on the ground, demonstrating concretely how decentralized cooperation between local and regional governments and their associations can bring tangible results on the ground. So we would like to share with you examples from 3 different countries around the Mediterranean, from Morocco, from Tunisia, and from the Palestine. And we have 4 distinguished speakers, and I would like to give the floor to Madame Zaki Amrini, a member of the House of Representatives in Morocco and president of the Moroccan Institute for Local Development, IMADEL, to tell us something about the cooperation between the region Marrakech-Safi in Morocco and Barcelona province in Spain, which was also awarded the first prize this year in our prize, which we give to excellent examples of development cooperation practices and projects in PLATFORMA. So welcome and congratulations again to the laureates of the winners of PLATFORMA Awards this year. And the floor is yours, Madame Zaki Amrini.
Merci beaucoup. Bonjour, messieurs, dames. Je tiens à remercier les organisateurs de ce débat qui vise à explorer le paysage des droits de l'homme au niveau local et régional dans la Méditerranée. Le Maroc, bien sûr, avant de donner donc, notre expérience, j'aimerais bien dire que le Maroc, qui est touché également, comme tous les pays du monde, par la COVID-19, il mène toujours une politique intégrée de protection des citoyens et citoyennes depuis début mars. Et je peux signaler, quand on parle des droits de l'homme, que les conséquences étaient énormes pour les citoyens vulnérables en général, des conséquences socio-économiques essentiellement, mais je précise que les femmes, parce que c'est le thème sur lequel nous travaillons dans ces projets dont je vais présenter tout à l'heure, les femmes au Maroc sont bien sûr les plus touchées par les conséquences de la COVID-19, surtout les femmes démunies, les femmes rurales. Alors, je suis censée partager avec vous dans cette rencontre notre expérience de coopération dans la région méditerranéenne entre IMADEL, qui est l'Institut marocain pour le développement local, qui est situé à Marrakech, et la députation de Barcelone. C'est un projet notre coopération avec la députation de Barcelone a commencé depuis 2008. Nous travaillons sur le renforcement des communes marocaines, sur la démocratie.
Your microphone is muted. Could you please unmute yourself? Est-ce que vous pouvez brancher le micro, s'il vous plaît?
Oui. Donc, j'ai dit, je vais présenter 2 projets que nous avons travaillé en collaboration avec la députation de Barcelone et qui touchent essentiellement les droits des femmes et la lutte contre la discrimination contre les femmes, surtout au niveau local. Alors, notre premier projet, comme vous venez de dire, monsieur le présentateur, c'est notre projet qui a eu le prix de la PLATFORMA Award cette année. C'est un projet qui a fonctionné de 2017 à 2019 il concerne la coopération décentralisée dont les partenaires sont la députation de Barcelone, IMADEL, les communes marocaines et les communes de Catalane. Alors, ce projet était essentiellement la création d'une plateforme d'échange entre les communes marocaines et les communes catalanes et le partage des bonnes pratiques innovantes dans le domaine de la participation citoyenne et dans les politiques territoriales fondées sur le genre. Alors, je peux dire que ce projet, comme j'ai dit, qui a eu ce prix de PLATFORMA Award, il a touché pour la première fois ce sujet de l'intégration de l'approche genre dans la gestion locale. L'intégration de cette approche genre, il existe dans les lois des communes au Maroc et des régions, mais malheureusement, l'application et la réalisation de cette approche sur le terrain est encore très difficile pour les communes marocaines. parce que les communes marocaines, c'est une expérience qui est récente, elles sont confrontées à d'énormes problèmes. Et donc, le sujet de l'égalité entre les sexes reste toujours à l'écart. Et donc, ce projet-là, il a permis pour la première fois de renforcer certaines communes marocaines sur comment intégrer l'approche genre, comment lutter contre les inégalités entre les sexes dans les politiques publiques locales. Et on a vu pour la première fois la création des centres d'écoute par les communes, des centres d'écoute contre la violence à l'égard des femmes par les communes. Pour la première fois, on voit des services, la création de services spéciaux au sein des communes dédiés aux problèmes des femmes, d'énormes projets touchant les femmes. Alors maintenant, depuis cette année, nous travaillons sur un deuxième projet, un nouveau projet. Ce projet, il permet de renforcer encore plus les communes marocaines sur l'intégration de cette approche et sur l'évaluation des politiques publiques en général, l'évaluation de toutes les politiques publiques des communes si elles respectent bien sûr cette approche genre. Alors ce projet qui va durer jusqu'à fin 2021, il est censé normalement à permettre aux communes et de les accompagner à respecter les droits des femmes et mener une politique fondée sur le genre. Et également, ça va permettre également de renforcer le rôle de la société civile et le rôle des femmes, surtout les femmes élues. Donc, il y a tout un travail d'échange qui va être mené entre les femmes marocaines, les femmes espagnoles, le renforcement des femmes et le renforcement de la société civile qui vont accompagner toute la politique des communes qui sont partenaires dans ce projet. Et bien sûr, comme je n'ai pas beaucoup de temps, je peux dire que ce projet va permettre encore plus de renforcer cette coopération entre les municipalités marocaines et les municipalités de Barcelone. Et on va essayer d'intégrer d'autres municipalités dans la région méditerranéenne. Et merci encore.
Merci beaucoup. Thank you very much, Madame Rini, for having this inspirational example. And we will straight go to the next example so that we have a mix of inspirational ideas in a short block, and then we can open discussion. So please, Abdellah Hanati, Executive Director of the Association of Palestinian Local Authorities, will tell us something about local authority initiatives to overcome challenges in a fragile context. Please, Abdellah, the floor is yours.
Thank you, Boris. Good morning, everyone. Thanks for inviting me. I will speak in Arabic because I have very limited time, so I will be faster when I speak in Arabic. So, في البداية الجميع بعتقد عنده فكرة عن الوضع في فلسطين والتحديات اللي بنواجهها بشكل يومي بسبب ظروف الاحتلال الإسرائيلي. والاحتلال ينتهك حقوق الإنسان الفلسطيني بشكل يومي، سواء بالقتل أو بإعاقة الحركة أو بحرمان المواطنين الفلسطينيين من الوصول لأساسيات الحياة من مياه وكهرباء وإلى آخره. وجاءت جائحة كورونا وأضافت أعباء كثير كبيرة على الوضع في فلسطين، وكان مطالب الشعب الفلسطيني والمؤسسات الفلسطينية بشكل عام بابتكار وسائل إبداعية للتغلب على هذه التحديات. واليوم راح أركز بشكل رئيسي على الجهود اللي قامت فيها البلديات في فلسطين لضمان وصول المواطنين إلى الخدمات الأساسية. ومهم الإشارة في البداية إلى أنه ما يقارب 70% من أراضي فلسطين أو أراضي الضفة الغربية هي خارج سيطرة الحكومة المركزية، وهي مصنفة ما يسمى مناطق جيم. وبالتالي البلديات أو الهيئات المحلية تشكل الشكل الوحيد للحكم في هذه المناطق، وما تم اتخاذه من قرارات على المستوى الوطني على مستوى الحكومة المركزية كانت البلديات هي الجهات الوحيدة القادرة على تنفيذه. ما في أجهزة أمنية على سبيل المثال في هذه المناطق اللي بتشكل حوالي 70%، وبالتالي البلديات شكلت فرق التطوع من الشباب ومن المواطنين للمساعدة أو المساهمة في تنفيذ القرارات الحكومية. تحدي رئيسي بواجه المناطق الفلسطينية هو عدم السيطرة على الحدود والمعابر، وهي يتم التحكم فيها من خلال الاحتلال الإسرائيلي. والحركة كانت تحدي كبير، جزء كبير من الفلسطينيين بيعملوا داخل إسرائيل، وكانت السيطرة على تنقلهم ما بين فلسطين وإسرائيل تحدي كبير. ولذلك البلديات الفلسطينية ابتكرت آلية جيدة للتعامل معهم، وارتكزت بشكل رئيسي على مبدأ التعاون الإقليمي التريتوريال انتجريشن. شكلت فرق طوارئ أو فرق عمل مشتركة ما بينها، تولت عملية التعامل مع العاملين اللي بالجانب الإسرائيلي. في فلسطين حوالي نصف السكان هم لاجئين بالأصل، والمخيمات جزء كبير من المخيمات اللاجئين في فلسطين تقع في قلب المدن الفلسطينية، ومسؤولية تقديم الخدمة في هذه المخيمات هي مسؤولية الأونروا بشكل عام. ولكن الأونروا بتواجه تحديات قبل جائحة كورونا، ومع الجائحة تضاعفت هذه التحديات، وكان لزام على البلديات الفلسطينية. يعني أخذت الهيئات المحلية بفلسطين على عاتقها مساعدة اللاجئين في هذه المخيمات، وقدموا لهم مختلف أنواع الخدمات من ناحية النظافة العامة، من ناحية تعقيم الأماكن، إنشاء مراكز العزل، تقديم الخدمات الصحية وخلافه. وبالتالي كان إطار العمل التكاملي والتشاركي بين البلديات وبين المناطق المهمشة هو عنوان هذه المرحلة. وإحنا في فلسطين متعودين بطريقة أو بأخرى على التحديات الشبيهة بجائحة كورونا بشكل يومي، وإحنا بنعاني من هذه التحديات بشكل يومي. من المبادرات المميزة واللي تم الإشارة إلى تحدي فيما يخص التعليم في بداية هذا الحديث، جزء كبير من البلديات خصوصا في المناطق النائية والمناطق الأشد فقرا أسست أو استغلت أو خصصت جزء من مرافقها لطلبة المدارس، وزودت هاي المرافق بالأجهزة والمعدات اللازمة لتسهل عليهم عملية متابعة تعليمهم عن بعد باستخدام وسائل تكنولوجية. وجزء كبير من البلديات ومن الهيئات المحلية الفلسطينية شكلت لجان متخصصة للمرأة ولكبار السن، واللي كانوا حريصين على متابعة احتياجاتهم بشكل دوري وبشكل متواصل. باختصار وفي الحديث يعني بيحتاج ساعات لنحكي عن المبادرات اللي عملتها فلسطين أو البلديات الفلسطينية، ولكن كان عنوان المرحلة في جائحة كورونا أهمية العمل المشترك ما بين الهيئات المحلية، سواء في إطار حدودها ومسؤولياتها الجغرافية أو مسؤولياتها حسب القانون، وإنما تخطط ذلك بأشواط كبيرة للعمل قدر الإمكان على ضمان وصول المواطنين الفلسطينيين على اختلاف أماكن تواجدهم للخدمة بشكل عام. شكرا جزيلا.
Thank you very much for this outline of the situation at the ground, at the local level in Palestine. And then we jump a little bit more to the west and we'll hear an example presented by Sergio Castañar-Espacio, the coordinator of the Andalusian Fund of Municipalities for International Solidarity, FAMSI, who is the coordinator for Morocco. So Sergio, please tell us something about your examples of this decentralized cooperation between local governments and EU regions in the neighborhood policy in the context of COVID-19, obviously. Sergio, the floor is yours.
Buenos días, Boris. Buenos días, participantes. Sí, mi intervención, bueno, quiero hacer un pequeño repaso sobre la experiencia de nuestra organización, del Fondo Andaluz de Municipios, en el tiempo que llevamos trabajando en Marruecos. FAMSI, como sabéis, es una red de municipios que agrupa más de 150 colectividades locales de Andalucía y que se constituyó en el año 2001 y que por situación geográfica... ¿Sí?
Video, please.
¿Se me escucha?
Yes.
Ok, vale. Por nuestra situación geográfica, Marruecos siempre ha sido una prioridad en nuestra cooperación. Esta llamada frontera sur, ¿no? Que para nosotros es un territorio transfronterizo, donde tenemos una historia común, yes, donde hay poblaciones que van a caballo, que están a caballo entre las dos fronteras, donde hay lazos humanos, lazos empresariales, lazos económicos y culturales. Entonces, bueno, desde un principio siempre FAMSI ha tenido el deseo de trabajar con sus homólogos ayuntamientos en Marruecos. Una solidaridad que ha sido, que es fruto de la población andaluza, del deseo de la población andaluza y de sus ayuntamientos, y que se ha desarrollado en gran medida gracias a las políticas europeas de vecindad de estos últimos 20 años. Actualmente, bueno, pues como los compañeros han estado explicando, tanto en Andalucía como en Marruecos vivimos, y en otras partes del mundo, vivimos esta situación de COVID-19, de pandemia, y que nos han llevado en ambos territorios pues a una pérdida, a un retraso en nuestro desarrollo, que ha hecho mella, desde luego, en las poblaciones más vulnerables que habéis citado, bien evidentemente las mujeres, los niños, la población migrante y otras poblaciones marginadas, sociales y económicamente, que se hallan en nuestras ciudades, en nuestros barrios periféricos y donde el COVID ha hecho mayor mella, ¿no? En el caso de Marruecos, por citar algunas cuestiones, vemos como la violencia de género efectivamente ha aumentado. Vemos como la brecha digital no ha permitido la educación de muchas poblaciones de niños. Vemos como los migrantes y muchas personas pertenecientes a la migración, a la economía informal, pues no han recibido la ayuda necesaria que el gobierno ha puesto a disposición. Y bueno, y vemos que los focos de COVID, donde mayor incidencia ha tenido, pues efectivamente han sido en las poblaciones donde encontramos mayor densidad, en las fábricas, en las cosechas de fresas o de frutos rojos, por ejemplo, en el caso de Marruecos, ¿no? En Andalucía pues también ha sido algo similar, ¿no? Ha sido algo similar. El COVID se ha cebado en estas poblaciones, también en las personas mayores, por el sistema, bueno, el sistema de asilos que tenemos, donde ha incidido más el COVID, ¿no? Yo creo que esta situación de pandemia y las soluciones a la crisis, pues efectivamente pasa por reforzar nuestras administraciones de cercanía, que son nuestros ayuntamientos, que han demostrado durante mucho tiempo pues, que tienen la capacidad, que conocen el territorio, que son coordinadores del territorio y de las entidades que se dan en él. Pasa también, como no, por las redes de ayuntamientos, como puede ser el propio FAMSI o la Federación AMMAR, porque tienen esa capacidad técnica que muchos ayuntamientos, por su tamaño, pues no lo consiguen o no tienen acceso a ciertas ayudas. Y estas redes permiten desarrollar un trabajo más horizontal entre ayuntamientos, transferir conocimientos y tener aprendizajes mutuos, ¿no? Efectivamente, también hace falta la participación de la sociedad civil del territorio, más allá de los ayuntamientos, Y desde luego los fondos. Hacen falta fondos para que los ayuntamientos implementen las políticas necesarias en el territorio. En este sentido, sí quisiera bueno, hacer algún comentario, ¿no? Consideramos, como ha dicho algún periodista, que en Marruecos realmente las colectividades locales o los plenos de los ayuntamientos son la cantera de la democracia. Es decir, es donde se fraguan esos futuros políticos, donde se da un espacio de diálogo, de democracia abierto. Entonces son también un punto de desarrollo de la democracia y de la buena gobernanza importante. Y también me gustaría ligar tanto el tema de la pandemia y sus soluciones y los ayuntamientos a la agenda local, o sea, a la agenda global y su nivel local. Sabemos que el 70% de los objetivos de desarrollo sostenibles inciden sobre el nivel local. Así que forzosamente las soluciones pasan por ahí, porque muchos de estos objetivos de desarrollo sostenible son parte de la solución al COVID. La lucha contra la pérdida del territorio, de nuestro medio ambiente, lo diré. La pérdida de nuestro entorno, el desarrollo de la economía local frente a la globalización deshumanizada en la que vivimos, la defensa de lo público, de la gestión de lo público, la igualdad al acceso de vacunas, de la sanidad, todo eso se debe de hacer desde lo local. Además, incluyendo procesos de transparencia, de buena gobernanza, que tomemos las decisiones juntos a nivel local para luchar contra el COVID. Esto es fundamental, que no hagamos política del COVID, ¿no? Por decirlo de alguna manera. Bien, y todos estos puntos que intento subrayar, bueno, pues es un poco lo que desde FAMSI y con nuestros socios en Marruecos, que tienen como referente la Federación AMMAR de Colectividades Locales, y que es una asociación de ayuntamientos, de más de 70 ayuntamientos, ¿vale? Es un poco lo que hemos venido haciendo durante todo este tiempo, pues implementando proyectos ligados a las competencias de los ayuntamientos, como puede ser, bueno, pues la defensa de la promoción de la participación y la gobernanza, y la buena gobernanza en los ayuntamientos, con proyectos como de presupuestos participativos, con proyectos de género, incidiendo en la planificación estratégica de los ayuntamientos, en la planificación comunal, pues haciendo planes con perspectiva de género, aunando al mismo tiempo políticas locales con políticas nacionales que nos han permitido también en nuestro trabajo de más de 20 años, pues tener un marco de trabajo pues, con la Dirección General de Colectividades Locales del Ministerio del Interior, o acuerdos con ONU Mujeres o con la OIM, o con la Red de Mujeres Electas de África, o con CGLU. Es decir, trabajamos lo local, pero siempre con una referencia nacional o internacional que haga ese camino de ida y vuelta. Es decir, que la experiencia local se retroalimente de la experiencia internacional y viceversa. Siempre tenemos que contrastar, siempre tenemos que estar cerca de las personas más vulnerables de nuestros ayuntamientos que conocen esta realidad, ¿no? Podría seguir hablando de proyectos que hemos desarrollado, que estamos desarrollando y que inciden, por ejemplo, en el desarrollo económico local. Hemos creado en estos años 3 agencias de desarrollo local en Marruecos, que precisamente lo que defienden son es la definición de una estrategia económica local con sus actores con productos locales, con parámetros de sostenibilidad del territorial, con la defensa y la puesta en valor de sus hechos diferenciales. Es decir, cuestiones todas que están muy relacionadas en realidad con la lucha contra el COVID. ¿Y por qué se produce el COVID? El COVID realmente se produce por una destrucción del medio ambiente, porque entramos en contacto con unos virus con los que antes teníamos una barrera natural. Se produce porque la movilidad internacional en este siglo XXI pues permite portar un virus en cuestión de horas de una parte a otra del mundo. Y todo esto pues lo tendremos que revisitar, volver a estudiar desde lo local y desde todas las esferas. Y nosotros pretendemos...
Maybe one more minute.
Ok. Creo que nuestro trabajo futuro, ¿vale? Pues ha de incidir en la replanificación estratégica de nuestras ciudades, de nuestras políticas, en estar atentos a la defensa de nuestras poblaciones, especialmente las más vulnerables, y sobre todo, y era el hilo conductor de esta intervención y de la conferencia, la defensa de los derechos humanos de todas estas personas, porque van muy ligadas, efectivamente van muy ligadas a la propia lucha contra el COVID. Bueno, muchas gracias, eran muchas ideas en muy poco tiempo. Muchas gracias por darme este espacio y a Fancy y buena continuación. Gracias.
Thank you very much, Sergio. Muchas gracias. Thank you for your contribution. And to skip the time, please, Naila Akrimi, Director General of CILG VNGI, which is a branch of the Association of Dutch Municipalities present in Tunisia, telling us a little bit more about the work on the ground in the country. Please, Dr. Akrimi, the floor is yours for 5 minutes.
Thank you. For speaking last will be a big challenge to be very sharp and to the point. There's also a privilege because so much things have been said and that which I really relate to. As you said, as an association of municipalities working on the ground and in countries of the MENA region, the neighborhood south of the European Union, the COVID-19 had put us into a big challenge. We have been following and supporting countries in their decentralization processes, lobbying and advocating for the role of municipalities as an important actor for development and governance. And the COVID-19 came surprisingly to everybody else, and thinking, how can we reinvent our governance system to be able to really face this crisis? And the good thing about it, I mean, the COVID-19 is definitely a very bad crisis, but the good thing about it is that so many countries have been really recognizing local government as an important player in fighting the virus and working on an integrated crisis response. And this is what we have been seeing in so many countries in the region, in Libya, in Tunisia, in Algeria, and Morocco, and also so many countries in the Middle East, and the Palestinian case has been presented. The question is that how to relate this new system of governance where municipalities are involved and recognized as an actor to the dilemmas Professor Kapila had mentioned, being the dilemmas of human rights, dilemmas of finding the very practical solutions to universal dilemmas. One of them is about being very close to the needs of the population at a certain place. I mean, we talk a lot about disinfecting and creating a space where everybody can feel safe. But if in some, for example, municipalities and areas, those basic needs are not even provided. In countries where local governments are really having very, very difficulty struggling with a basic service provision. So there is definitely a very important point of solidarity here to support municipalities to play this important role. Local governments are the one taking care of public spaces, and we know how important public spaces are to face the the COVID-19 crisis. We know also the question of mortuary and municipal services and how this has to be really well organized. Wash, water and waste management, these are also aspects managed by municipalities and has a lot to do with hygiene and health sector. When it comes also to the question of safety and security and the impact of that on the population, we had witnessed times of lockdowns where there was also questions of security and safety in the public space has been shared with so many municipalities, and also the impact of the whole situation on women and on girls. And this is something that I would like also to share with you that have been mentioned before. But the impact of COVID-19 has been very, very dramatic on so many women in the region, but also all over the world. In terms of the economic, I mean, they have been really hit because most of the women are working in informal sector, and it has been very difficult for them to be able to recover from that. Also, the social burden. So many women are taking care of their elderly or their kids at home because of the lockdown, and this is really unpaid work. And also, if you look at their production health aspects, women have been really facing a lot of trouble because of the COVID-19. And something has been also mentioned before when it comes to violence, when it comes to a lot of very vulnerable situations where women have found themselves in municipalities. The good thing about it is that facing all those problems and in a recognized place where the municipalities are well recognized and an important actor, the municipalities took up their social and economic role. And we saw so many municipalities working on campaigns to have an inclusive crisis response, taking care of gender inequality and giving a space for women, be it in creating homes for women who cannot, who have been violated in their homes, or also creating mental social support to families and women who are really facing a lot of trouble. So what I would like to say here is that in the COVID-19 times and the crisis response that needed an inclusive and integrated approach, municipalities have been playing an important role. And in that role, the social role has been really one of the most relevant. We saw that in countries where decentralization processes are just starting. I'm giving the example of Algeria, for example, where civil society organizations, municipalities have been working hand in hand with wilayas to be able to respond, which is quite interesting in a country where the decentralization processes have been going slowly. When it comes now to finding a practical solution to universal dilemmas, I really would like to stress on something important. You know, we are now talking also at an EU neighborhood policy, and I like so much the citation of Jean Monnet, who has been the founder of the EU, when he said the European Union is the sum of its crises. And I do believe that the world is also a sum of its crises, and we have to make a positive sum out of it. And for that to happen, a role of local government is very important in order to get out from this COVID-19 crisis, reinventing ourselves and finding a code of conduct where we can all contribute for a better world. And I do believe that local governments, decentralized cooperation, and all those networks that are really advocating for this important role should be really put forward. Thank you so much for it.
Thank you very much, Dr. Akrimi. And thank you to all our speakers who had shown us what they can do concretely on the ground. And even if we have a little bit of a delay, we would like to provide you, all the participants, with a short space to either ask a question or make a very, very short contribution, please. And I would like to invite the first participant, Belal Kassim, the Vice President of PAM, who wished to make a very short intervention. Belal Kassim, the floor is yours. Hello? If we don't have Mr. Kassim online, we had Kenza Ajala who wished to speak for a very short intervention, please.
Hello.
Mr. Kassim, thank you very much. Bonjour.
أسعد الله صباحكم جميعا. في البداية بنشكر بلاتفورم ونشكر الجمعية البرلمانية المتوسطية على هذا اللقاء المهم، وبنشكر كل السادة المتحدثين على المعلومات القيمة حقيقة التي استمعنا إليها. كان عندي الكثير لأحكيه حول الأوضاع في فلسطين، لكن الأستاذ عبد الله حناتي الحقيقة بتشكره اللي وفر علينا الكثير من الكلام. وبالمختصر أيضا هناك معاناة حقيقية في مخيمات اللاجئين الفلسطينيين في لبنان وفي سوريا نتيجة الاكتظاظ السكاني ونتيجة عدم الاستعدادات الكاملة لمواجهة هذه الجائحة كوفيد 19، حيث أن الدول العظمى لم تستطع أن تواجهها بشكل مناسب، فكيف بمخيمات واكتظاظ سكاني وقلة الإمكانيات. لكن بنفس الوقت نتشكر كل الدول اللي دعمت وكالة الغوث الأنروا لتقوم بجزء مهم من دورها في المخيمات، وهنا أخص بالشكر دول الاتحاد الأوروبي. لن أطيل عليكم، كما قلت استمعت إلى كلمات مهمة. نأمل في المستقبل أن تكون لنا لقاءات لمواجهة هذه الجائحة بشكل أفضل وبشكل مشترك، بما يضمن حقوق الإنسان في كل مكان، الإنسان أي إنسان دون النظر إلى جنسه أو لونه أو جنسيته. شكرا كثير لكم، وشكرا على هذا اللقاء المهم الذي عقد اليوم، وشكرا.
Thank you very much, Shukran. Thank you for your contribution. We had Kenza Ajala asking for the floor. Hello, Kenza Ajala. If not well connected, maybe we'll skip and give the floor to Mr. Musi Amar. Mr. Musi Amar, for a very short intervention, please. You had your hand raised.
نعم. نعم سيدي الفاضل، أود أن أقدم لمحة بسيطة عن التجربة الجزائرية بالنسبة للكوفيد. طبعا في المرحلة الأولى كانت معظم القرارات مركزية، يعني وجاء الحجر العام ثم أنشئت خلية أزمة لاتخاذ الإجراءات الصحية والاجتماعية والاقتصادية المرافقة. كما تم إصدار قانون مالي خاص بهذه المرحلة للتكفل بهذه الأوضاع الطارئة. تلك الفترة كذلك تم إجلاء كل الجالية الجزائرية الموجودة بالخارج، وهذا على عاتق الجزائرية، مع ضمان الحجر الصحي كله على عاتق الدولة الجزائرية. وفي الفترة الأخيرة تغيرت العملية وإشراك السلطات المحلية والحكومات المحلية في اتخاذ قرارات، وكذلك إشراك الجمعيات والجمعيات المجتمع المدني كذلك المساعدة لمكافحة هذا الوباء. فقد تم توزيع أو قد تم رفع الحجر الصحي مثلا في مناطق وتركه في مناطق أخرى حسب الحالة. هنا طبعا يتم التنسيق بين السلطات المركزية والسلطات المحلية. أنتم تعرفون أن الجزائر شاسعة جدا ومتنوعة في مناخها وفي تركيبتها الجغرافية. وتعمل الآن السلطات المحلية والمؤسسات على تقييم الوضع الوبائي من أجل تحضير الدخول المدرسي والدخول الاجتماعي والدخول الجامعي كذلك حالة. وذلك باحترام البروتوكول الصحي الموجود يعني والمطبق حاليا. هنا أود أن أعطي صورة من صور التضامن ومن صور احترام حقوق الآخرين. هنا في مسكرة في ولايتي مدير مستشفى أصيب والده بداء كورونا وكان مريض جدا، وكان له عدد محدود من أجهزة الإنعاش. كان أبوه في حال إلى سرير إنعاش، لكنه لا يستطيع أن يأخذ سرير الإنعاش من مريض عادي إلى أبوه، وتوفي والده في تلك الفترة. وهذه أسمى صور الإنسانية والمساواة في الحقوق والواجبات. طبعا الآن الجزائر تمر بمرحلة انتقالية ومرحلة تغيير سياسية أنتم تسمونها. كانت انتخابات رئاسية ونحن على أبواب انتخابات برلمانية وحكومات مالية. وطبعا الجميع يريد استغلال هذه الظروف، ولكن نقول أن الجميع تحت القانون والقانون فوق الجميع. هناك نواب برلمان متابعون قضائيا، وهناك مسؤولون كبار متابعون قضائيا، وكذلك هناك صحفيون متابعون قضائيا. الجميع سواسية تحت سلطة القانون، ونتمنى أن يرفع عنا هذا البلاء في أقرب الآجال. وشكرا.
Thank you very much. Thank you very much for your contribution. I'd like to give the floor to Mr. Jdidis Boui, who asked for the floor. Jdidis Boui wanted to speak. If not, we'll just skip the time and give the floor to Mr. Vincent Garcés from the Mediterranean Citizens Assembly Foundation. Mr. Garcés.
Sí.
Please, 1 minute.
Soy Vicente Garcés. ¿Me escuchan?
Yes.
Buenos días, soy Vicente Garcés, soy el presidente de la Fundación Asamblea de Ciudadanos y Ciudadanas del Mediterráneo, que es una fundación que está extendida por todos los países del Mediterráneo y practicamos la diplomacia ciudadana. Tengo que agradecer la invitación a participar y felicitar tanto a la Asamblea Parlamentaria del Mediterráneo como a PLATFORMA por esta iniciativa que señala el gran interés y necesidad de conjuntar los esfuerzos, las capacidades, las energías de las autoridades locales, las entidades locales, sean ayuntamientos o regiones, y los ámbitos parlamentarios. Es una iniciativa que vale la pena continuar y desarrollar. He de decir que nosotros acabamos de hacer un estudio en el Mediterráneo sobre las desigualdades económicas y sociales y hemos concluido que en los últimos años las desigualdades económicas y sociales han crecido entre los países y dentro de cada país. Esto significa que en época de pandemia y post-pandemia esas desigualdades van a aumentar todavía más. Si ahora ya son fruto de contradicciones enormes entre el sistema sanitario y su aplicación, según las capas sociales, post-pandemia esta situación se va a agudizar. De ahí que digamos que la defensa de los derechos humanos va a ser un imperativo si no queremos caer en grandes dificultades para la democracia. La defensa de los derechos humanos es también la defensa de las responsabilidades sociales, económicas y culturales, tanto de la ciudadanía como de las instituciones públicas de carácter político. Por tanto, hay que seguir insistiendo en esa defensa. Por nuestra parte, como fundación, estamos desarrollando un máster en Derechos Humanos en el Mediterráneo para facilitar precisamente tanto la formación como la divulgación de los derechos humanos en el Mediterráneo. Ya sé que tengo muy poco tiempo, no puedo decir nada más. Muchas gracias y animo a todos, entidades locales, regionales, parlamentarias, a contar siempre con la voz de la ciudadanía para la expresión de sus voluntades. Muchas gracias.
Thank you very much for your contribution and also for your work that you do also on the ground with the citizens. And I am apologizing deeply to all those who still wish to speak and express their opinions, but due to the delays, we are already at noon, so we really need to close up the webinar. But before giving him the floor for the concluding remarks, I would like to thank His Excellency Ambassador Sergio Piazzi, Secretary General of the Parliamentary Assembly of the Mediterranean, for the partnership we established for this webinar. We think that crossing the world of parliamentarians and local governments became very evident, especially thanks or due to the crisis. So I hope that we will establish a dialogue, as several of the speakers suggested, between local governments, regional governments, and other levels of governance towards better solutions for the citizens. So thank to all the participants for your patience and focus during this event. We hope to meet you soon at one of the next PLATFORMA webinars. And thank you very much also to the interpreters. Thank you very much. Merci beaucoup. Muchas gracias. Shukran jazilan to all who participated. And I would like to give the floor for concluding remarks to Ambassador Sergio Piazzi. Sergio, the floor is yours.
Dear Boris, thank you very much. Good morning to all of you. And I would like to start by thanking all of you for the participation, the attention, the exchange, also in preparing this event. The colleagues of PLATFORMA on one side, and in our case, all the parliamentarians and the senior advisors. Has been an excellent experience, because parliamentarian on one side and local regional government administration do not live in isolation. One is the next step of the other in a continuum cycle. The aim for all of us is to provide the best possible service to our citizens, to our fellow citizens. And by doing a good service in our countries, we serve the community, and we, in our regional extra-national dimension, we ensure a better life for everybody. So my thanks to all of you. My comment is on the title, because we are speaking about, in our title, the human rights and post-COVID. As we see what is happening now, we are in full COVID again, with a different experience, but we are still there, with the countries locking down, other adopting national measure, other restricting the movement across borders, because the emergency is ongoing. And therefore, this requires an adjustment of what is the activities of those who administer our cities, our provinces, our region, and the work of our parliamentarians. And here, the debate I could witness today, and I think you will agree with me, as the proven evidence of the necessity to bring the debate on a larger scale, involve everybody and for everyone to benefit from the lessons learned and the best practices. And as we heard from colleagues from the European Parliament, the Italian Parliament, the Algerian Parliament, the Palestinian National Council, it is a common problem for all of us. The colleagues from the community from Morocco, from Tunisia, were there, and we have heard them. What I would like also to add, that there is a responsibility, and there is a very close connection between human rights and what is happening now. We have identified in the course of the discussion today many key words that, if you wish, help us to identify the preoccupation, the concerns of our administrator, of our parliamentarians. The role of territoire, the role of the administration, globalization, the interconnection between the North and South, East and West in our case, the ecological, environmental transition. What is going now in Brussels, extremely important for all of us, is the new approach to migration, because we have seen that Dublin has its limit, this limit has been bypassed, and the system is not sustainable at all. We have seen the impact of new technologies, the digitalization. A key word which came out today was resilience, because the social networks, if you want, the safety net, which have been in place by the people themselves and then with the administration, has been instrumental to limit the impact to the maximum possible, to avoid the riots in our city. We have seen what was happening where there was no money, people were unemployed, and there were attempts to loot supermarket for food. This is in the Euro-Mediterranean area in 2020. So the resilience. Key words included decentralization, and this is an evidence. The vulnerable groups, not only women and children, but all those who have been rendered vulnerable by such a health social, economic crisis. And here the key role of the local administration or local government, because these are the entities which deal with the people every day. The parliament from the capital can help, can assist, but in the end, our local administration who go door by door with the social services to, if you want to put patches on those situations which are critical for an individual. And our society is made out of individuals. If we fail with one, we fail with all. And this is extremely important. Therefore, I could see this natural synergy between what PLATFORMA is doing, what PAM is doing, and I see this as a beginning of a very mutually beneficial partnership between the two of us. You heard the words from our member of parliament, for instance, which coincide with those of the administrators. What this human rights close connection with the COVID has carried out. The issue of migration, regular or irregular. We had plenty of people in our countries in irregular status, but which still need assistance. The basic assistance that every human being is entitled to. The food security. Not only when countries close the border and start stopping exporting food in the big chaos of the first weeks of the pandemic, but also when people had no money to afford buying food for themselves and their families. These are all human rights. These are only basic rights. The right to food, the right to education, the right to health, the right to work. You see how our discussion today is going so deep in the bolt and nuts of what our societies are. We have seen Honorable Hermes clearly indicated the issue of domestic violence. In our country, all North and South, Europe and North Africa, there was an average increase of 30% of domestic violence because the people were confined at home, if they had a home, within 4 walls. We had the issue of fake news. As Professor Kapiller said, everyone is more expert than the other one because internet give you everything. But as you know, the principle of internet, garbage in, garbage out. So unless we are able to a process of education through those sources of information that we consider reliable, such as WHO and other institutions, at least the basic information which allow the parliamentarians, which allow local administrators in this decentralized system to make, to the best of their knowledge, to the best of their consciences, informed decisions, which is extremely important. We had also to deal, and this was maybe more on PAM, what was happening in terms of terrorism during the COVID in our society. There was all a shadow work of our countries to reduce the limit of, reduce the risk, of terrorist attack. We were very vulnerable in that moment. All our police forces were in many countries involved in civil protection tasks. So there were big holes in the security nets. I have mentioned the issue of vaccination, public health, global health. This is one of the key issues on which all of you have pointed out. I would say that in my conclusion, we will try to put together a little report to collect the many ideas, the many experiences which have been raised today, is what we can do, learning from phase 1, learning from the ongoing phase 2 of COVID, in terms of lessons learned and best practices that can be shared among our constituencies, hopefully to be better equipped to continue during phase 3 and until a vaccine a vaccine which is effective will be developed and then made available to the population at large. I would like to conclude on this, not to take your time, to thank all of you, the member of PLATFORMA, the member of the parliaments. I have seen that we had over 100 delegates registered to this webinar with half. So it is really show the interest of the people in what we have discussed today. And I would like to conclude, as you did, Boris, to thank the staff of PLATFORMA, to thank the staff of PAM for the excellent cooperation, and to thank the interpreters who allowed us to communicate in different languages, including Arab Chinese. Thank you very much.
Thank you very much. And maybe the last thank you by Frédéric Vallier, the Secretary General of the Council of European Municipalities and Regions.
Yes, thank you, Boris. Thank you all speakers and interpreters and staff from PAM and PLATFORMA. And thank you, Sergio Piazzi. I think it's a great cooperation that we are starting with this first common seminar. And I'm grateful that it rose so much interest for both parliamentarians and local governments officials. So thank you all, and have a nice weekend.
Bye-bye.
Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you very much, everybody. Please
Thank
stay
you.
with us, subscribe to our newsletter, visit our website, and follow the work of PLATFORMA. We will have further interesting webinars in the future, so stay in touch. Thank you very much.
Bye.
Ciao, bye-bye.
Adiós.